I believe that a child is born, not at the time of birth, but at the time of conception. For 9 months, he intensely develops inside the womb, and already at this stage, the couple becomes parents. That is why it is so important to contact the fetus from the moment of conception. The child receives all emotions through the woman who bears it. That is why she must live in a positive environment. I will tell you a secret. Every pregnant woman believes that she commits a small miracle. This idea, in my opinion, is worth supporting. The more comfortable and good a woman feels, the better it is for your child. Therefore, for 9 months, the potential parents and the woman who will give birth to their child should stay together and build trust. The unborn child should listen to the voice of mom and dad. It will be useful to play for him the music that his family loves, so he will feel your love and care. These are useful emotions for him. At the same time, we cannot give a clear recommendation on how close this contact should be, how many times a week you need to make a call, how often to write, and what to talk about. For every pregnant woman, you need to find your own approach. This is important for the good of the child. Let's move on to preparing for childbirth. To begin with, parents can take a course of communication with the newborn. This does not take much time. It usually takes 2 to 3 weeks. The main objectives of the course are to teach you how to hold the child correctly, to teach him to take the bottle, and to prepare the formula correctly. Basically, intended mothers and fathers will master basic childcare skills. In addition, in such classes, you will learn many tricks. For example, how to get enough sleep when a newborn is in the house. I will not go into details, but deviating from the topic, I will tell you one trick. A healthy child has a very developed sucking reflex. Sometimes a child so actively sucks a mixture from a bottle that swallows a lot of air. Air stretches the stomach, and a feeling of fullness comes very quickly. After half an hour or an hour, the air leaves, the size of the stomach decreases, and the child again feels hunger. But if you select the bottle correctly and place the pacifier on it properly, then these problems can be avoided. The child will receive the necessary amount of milk and will sleep peacefully for 3 hours. But back to the topic of pregnancy and childbirth. I am deeply convinced that childbirth should be partnered. It is very important that mom and dad be the first to see the baby's eyes, hear his first cry, and cut the umbilical cord themselves. Can you imagine this feeling when parents cut the umbilical cord to their child? They give him a new life, take responsibility for him. This is an amazing moment. So first of all, parents should understand what periods the birth consists of and how they pass. The whole process can last 2 hours and even 24 hours. But it all starts from the first stage, the advancement of the child through the birth canal and the opening of the cervix. This period is very painful. Usually the more painful and intense the contractions, the faster the baby will be born. The second period is labor. At this point, the pain subsides, but the contractions become much stronger. They are joined by contractions, that is, the abdominal muscles begin to work. During this period, the child is born. This can take either 20 minutes or 2 hours, all individually. The most important thing at this stage is patience. Doctors control everything. They listen to the baby's heartbeat and understand how he feels. But parents need to know general facts about the condition of the child in order to own the situation and worry less. For example, the fetal heart rate should be approximately 140 to 160 beats per minute. If the heart beats more often or more slowly, then the child may be uncomfortable. Or another example, it happens that during childbirth, complications arise. For example, tight cord entanglement around the neck, and then the baby is born with a blue face. It is easier for parents who attended the birth to respond to this. They understand that this is not some kind of disease, but a temporary condition. After cutting the umbilical cord, the child is laid on the mother's or dad's chest for at least 2 hours. So the newborn becomes closer with the parents, listens to their heartbeat, smells them. Upon skin-to-skin contact, the child is colonized by the microflora of the parents. It is very good if the baby starts licking or sucking you. Often parents ask what to do at each stage of childbirth, how to help a woman in labor. This question should first be asked to the woman herself. Some of them experience pain so much that they do not want to contact anyone during childbirth. Others, on the contrary, ask to hold their hand, to talk. Personally, I always try to look into the woman's eyes when she is giving birth, and I also advise parents to do this. During childbirth, a woman is hurt, and such contact calms. It's like you're saying to her, you are not alone, you have support. And it really helps. In conclusion, I want to tell the simple truth. It is important for a woman who gives birth to a baby to understand that she did this for a good reason. Each of them is very happy when the parents tell them, "Thank you."